a guide for Iranian family caregivers of people with dementia. Welcome to the guide for Iranian family caregivers of persons with dementia. This guide is designed to provide care partners with the basic knowledge, tools, and strategies to cope with diagnosis of dementia in their loved ones and their caregiving demands. In our culture, taking care of the elderly is one of the major commitments for the families, and most families are opposed to letting their loved ones live in institutional settings. As a professional who has worked with older adults and their families, I have witnessed many challenges and struggles that dementia caregivers in Iran are dealing with. Due to the lack of public awareness about dementia in Iran, dementia may be considered as a part of normal aging or may be stigmatized. Also, the lack of knowledge about the progressive nature of this disease places lots of pressure on caregivers and their family systems. This guide is designed to help family caregivers to know what to expect as the disease progresses so they can plan ahead. Coping strategies provided in this guide gives family caregivers a useful tool to deal with adversities in their caregiving roles. I hope this package helps you provide optimal care along the continuum of the disease and assist you in the road ahead on your caregiving journey. What we should know about dementia. Module 1, Part 1. Dementia is caused by damages to brain cells. Dementia is a general term for collection of symptoms that include memory loss, mood changes, and problems with communication and reasoning. It is caused by damage to the brain cells and interferes with their ability to communicate with each other. When brain cells cannot communicate normally, a person's thinking, behavior, and feelings can be affected. These symptoms are severe enough to reduce a person's ability to perform everyday activities. Dementia is not a person's fault. It has nothing to do with their past life or character. It is a condition caused by damage to brain cells, and we do not know what causes this to happen. Module 1, Part 2. There are different types of dementia. Each part of the brain is responsible for different functions, for example, memory, judgment, and movement. Damage for particular types of brain cells in a particular section of the brain will cause a specific type of dementia. Dementia is a broad category word, just like the word cancer. Just as there are different types of cancers, there are different types of dementia. Some of the most common types of dementia are Alzheimer's disease. This is the most common type of dementia, accounting for 60 to 80% of cases. In Alzheimer's disease, brain cells are surrounded by an abnormal protein and their internal structure is also damaged. Gradually, chemical connections between brain cells vanish and some cells die. Issues with short-term memory are often seen first, but other symptoms may include difficulties with finding the right words, solving problems, making decisions, or perceiving things in 3 dimensions. Vascular dementia. This is the second most common dementia type and usually occurs after a stroke. In vascular dementia, because of narrowing or blockage of blood vessels, the oxygen supply to the brain is reduced and leads to some brain cells becoming damaged or dying. The symptoms can happen either suddenly following one large stroke or over time through a series of small strokes or damage to small blood vessels in the brain. Difficulties with problem solving or planning, thinking quickly, and concentrating are noticeable symptoms. Mixed dementia. In mixed dementia, abnormalities are associated with more than one type of dementia and mixture of symptoms. It is common to have Alzheimer's disease and vascular dementia symptoms together. Recent studies show that mixed dementia is more common than previously thought. There are other forms of dementia that are not as common, such as Pick's disease, dementia with Lewy bodies, Huntington's disease, Creutzfeldt-Jakob disease, and Parkinson's disease. While most changes in the brain that cause dementia are permanent, there are many other disorders that are reversible, such as thyroid problems, vitamin deficiencies, depression, medication side effects, and excessive use of alcohol. Module 1, Part 3. Dementia is not a natural part of aging. Despite the wrong assumption that we might have in our cultural beliefs, dementia is not a normal part of aging. Although it's true that dementia is more common among older adults, it is totally different sort of forgetfulness. The memory loss in dementia is more obvious and may be accompanied with mood changes and confusion. Module 1, Part 4. Dementia is not just all about the memory loss. People mostly think that dementia just affects people's short-term memory. In fact, dementia is more than just the memory loss, and it also affects the way people think, speak, understand things, feel, and behave. Dementia interferes with the ability to perform the activities of daily living. People with dementia have problems with keeping track of their keychains or wallet, paying bills, planning and preparing meals, remembering appointments, or traveling out of the neighborhood. However, in addition to problems with short-term memory, at least one of the other core mental functions must be significantly impaired. These include communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. Overall, there are 10 warning symptoms that people with dementia experience in different degrees. 1. Memory loss that interferes with daily life activities. 2. Difficulties in planning or solving problems. 3. Challenges in completing familiar tasks at home, at work, or at leisure. 4. Confusion with time or place. 5. Trouble understanding visual images and spatial relationships. 6. New problems with words in speaking or writing. 7. Misplacing things and losing the ability to retrace steps. 8. Decreased or poor judgment. 9. Withdrawal from work or social activities. 10. Changes in mood and personality. Module 1, Part 5. Dementia is progressive. Many types of dementia are progressive, meaning that a person's ability may deteriorate from day to day. However, the situation of every person with dementia is unique. In some people, abilities may deteriorate rapidly, and in other cases, it may happen more slowly over a number of years. Typically, symptoms start out slowly and gradually worsen over time. Early diagnosis is very important because it allows a person to get a maximum benefit from available treatment and provides time to plan for the future. In order to understand the changes that occur over time, dementia can be seen as a series of 3 stages: early, middle, and late. It can be a useful way to understanding the changes that occur over time. However, it is important to notice that this view of dementia can only provide a rough guide to the course of the illness. Problems common in early, mild stage. Difficulty remembering things that happened recently, losing and displacing items around the house, forgetting recent conversations or events, difficulty finding the right word or concentrating on a conversation, unwilling to try out and learn new things, confusion or losing track of the day or date, show poor judgment or find it harder to plan or make decisions, having problems viewing of objects in 3 dimensions, such as when park the car, lose interest in socialization and activities,